HIV and acquired immunodeficiency syndrome (AIDS) is a spectrum of conditions caused by infection of a retrovirus, which is known as human immunodeficiency virus (HIV). Following initial infection, an individual may not notice any symptoms or may experience a brief period of influenza-like illness. Typically, this is followed by a prolonged incubation period with no symptoms. If the infection progresses, it interferes more with the immune system, thus increasing the risk of developing common infections such as tuberculosis and tumor.
There are three main stages of HIV infection: acute infection, clinical latency, and acute immune infection syndrome. Acute infection, where individual will develop symptoms such as fever, large tender, lymph nodes, and throat inflammation. Clinical latency, where individual will not develop any symptom at first, but near to the end of this stage, many people experience weight loss. The most common initial condition of AIDS are pneumocystic pneumonia and cassia in the form of HIV wasting syndrome. People might develop various viral-induced cancers such as Kaposi sarcoma and Burkitt lymphoma.
HIV causes by a virus. It can spread through sexual contact or blood or from mother to child during pregnancy, childbirth, or breastfeeding. Behaviors and conditions that put individuals at greater risk of contracting HIV include having unprotected anal and vaginal sex, having another sexually transmitted infection, STI such as syphilis, herpes, chlamydia, gonorrhea, and bacterial vaginosis, sharing contaminated needle, syringes, and other injecting equipment, and drug solution when injecting drugs.
No vaccine to prevent HIV infection and no cure for AIDS. Use treatment as prevention. For example, taking HIV medication can keep your partner from becoming infected with the virus. If you make sure your viral load stays undetectable, a blood test doesn't show any virus, so you won't transmit the virus to anyone else. Use post-exposure prophylaxis if you've been exposed to HIV. If you think you've been exposed through sex, needles, or in the workplace, contact your doctor or go to emergency department as soon as possible. Within the first 72 hours can greatly reduce your risk of becoming infected with HIV.
We need to install the belief among society and the patient that the HIV-positive patients can still live a long and healthy life. We must have our regular and periodical health checkup so that we don't fall prey to this deadly disease. With the widespread awareness about the disease, much fewer adults and children are dying of AIDS. That is all from us. Thank you for watching.